And thanks so much for staying with us here in the 4 o'clock show. An estimated 70 million people here in the U.S. face SIBO, IBS, or other digestive health disorders. And joining us now to tell us about a brand that she is the innovator of, it helps people with these disorders still get the joy of eating, is Good Life founder Krystyna Houser. Hi, Krystyna, and thanks for being with us.
Hi, thank you so much for having me.
Well, as is often the case, one's own experiences leads to the creation of a solution. And that was the situation in your case, wasn't it?
Absolutely. The company was founded purely out of necessity and selfishly to keep me on track and healthy. But I'm so happy to be here to share everything I've learned and hopefully help a few people.
And what is kind of the key? First of all, what these various GI disorders, what's kind of the primary cause of most of them?
Well, that's an interesting question. The main cause of SIBO, for instance, is food poisoning. And our food industry, for instance, has a host of problems, but I'm sure we don't have time to dive into that. Um, one important one important fact is that 75% of IBS sufferers actually have SIBO. So for many years, people have been misdiagnosed. And if somebody's tuning in right now, having digestive health issues and being diagnosed with SIBO, it's important to note that they should consider being tested for SIBO as well.
Okay, that is good advice. So tell us a little bit about Good Life. Tell us a little bit about how it makes a difference.
Well, Good Life is based on the low fermentation eating plan developed by Dr. Mark Pimentel and Ali Rezai from Cedars-Sinai, who I was working with about 10 years ago when I was first diagnosed. And the diet plan is consists of low fermentation foods, which are easily digestible. So you don't want to leave excess fiber in your small intestine, which then feeds on extra bacteria when you have SIBO. It's a relatively easy diet plan to follow, and it's much less restrictive than the low FODMAP diet, which is what most IBS and SIBO patients turn to.
And what has been kind of your success rate? What variety of reactions and responses have you had from people who have tried Good Life and maybe even had it change their own lives?
Well, the diet seems to be very effective. It's a combination of diet and meal spacing. It's really important to allow your body 4 hours between meals to digest food properly. But Dr. Mark Pimentel and Ali Rezai have been working on this diet for the last 20 years, and the results have been fantastic.
Well, it's referred to as gut health, and most people probably don't think about how important that is and how it affects their lives in so many different ways, right?
No, absolutely. One of my main symptoms was depression and brain fog and rashes, which you wouldn't think have anything to do with your digestion or your small intestine. But clearly, everything is connected, and the rise in research of SIBO and IBS and the microbiome is very important right
Okay, it's Good Life. People can go online and they can find out more. Krystyna Houser, thanks so much for being with us and helping us out with this issue. We appreciate it.
now. Thanks for having me.